And good evening, everyone. I'm Derek Rose. Thank you for joining us for our Facebook Live discussion on what every family needs to know about opioids. We hope you found our special report over the last hour very informative. And so we wanted to bring a discussion to Facebook to answer some of your questions that you may have had after watching that special report. And we have a expert panel of guests to join us. We have John McGarry, the Assistant Special Agent in charge at the DEA Milwaukee District Office. Ashley Webb-Caleri with the Mark Wahlberg Youth Foundation. Ashley is joining us in place of Jim Wahlberg, who unfortunately was unable to be with us this evening. We also have Dr. Ryan Feldman, a toxicologist at the Wisconsin Poison Center, an emergency medicine pharmacist at the Medical College of Wisconsin, as well as Danielle Long, Opiate Initiatives Advisor for the Wisconsin Department of Justice. So we want to get our discussion started real quickly. And Ashley, I'll start with you as a representative of the Mark Wahlberg Youth Foundation. We know the foundation has a commitment to fighting the opioid epidemic. Why is the foundation so committed to this effort?
So our foundation exists to remove any barriers to success for young people. And it became very apparent that this opioid epidemic was a significant barrier for so many across the country in different communities. My boss, Jim, is a person in long-term recovery. A few years ago, he made, he's been making films for a while on this topic, but it was through the making of a film called If Only that we had, I want to say, the good fortune of meeting many parents who lost children, but obviously it wasn't their good fortune, right? It was a terrible ordeal for these families, but the families that we met turned it into an opportunity to be of service and to help the community. And so when Jim met those parents, it was sort of, it was what he needed to continue to do. And the foundation embraces this effort.
We can hear the passion in your voice as you explain the commitment the Mark Wahlberg Youth Foundation has with this project. I know the foundation has worked with, as you mentioned, a lot of families who have been dealing with the loss of loved ones to substance misuse. What advice do you have for the families who are trying to manage this kind of a loss?
So there are, unfortunately, many families. There are too many families. But as people in recovery communities know, there is a great benefit to being in the company of people who can understand what it is that you're going through. And I think that that's a similar situation for families who are dealing with this grief. There are organizations like one that I know and love is called Team Sharing, and they have chapters throughout the country that offer support to parents and families that are going through this loss. And I would just say, Jim always says, when people's children are sick with something else, right? Like, God forbid someone is diagnosed with cancer or some other illness, people bring casseroles and they try to be there for those people. And sometimes it's a little bit harder for people to understand when families are going through the ordeal of having a child or a loved one in this, in the throes of addiction or substance use disorder. And so one of the things that we often tell people when we speak to them in their communities is offer support to these families. They want to talk about their kids. They want they want to tell you about all the wonderful qualities that their children have and keep their memories alive and honor them. So I would say offer each other support and remember that we're all part of the same community and it's important to be there for one another.
Ashley, thank you. You answered our next question about what families, what the community can do. So thank you for those words. I want to move to Dr. Feldman, who was with the Wisconsin Poison Center and the Medical College of Wisconsin. Dr. Feldman, we get this question quite a bit. Why is it some people seem to develop an addiction to opioids faster than others?
That's a good question. Addiction is really a very complex disease that has a lot of factors that go into it, genetic, environmental, and social factors. And the long and short is We do not know who will become addicted or develop substance use disorder, as we often like to call it. But we do know that everyone is at risk, potentially, if they are taking opioids. But some risk factors can increase your risk. So genetic risk factors like having a family member or a personal history of substance use disorder. Coexisting mental health disorders can sometimes predispose you. Environmental or social factors like how a drug is being used, injection versus smoke versus oral, or having just access to opioids can play a big role as well. There's even differences in the likelihood of how much someone will like a drug, their own sensitivity to a specific drug, or the likability of a specific opioid. Hydrocodone is sometimes liked less than oxycodone. So it is very complex, and we don't know for sure who will develop substance use disorder on opioids, but everyone is at risk potentially.
My apologies for being muted there. So 2020 of me. And we want to continue to encourage our viewers to submit their questions here on our Facebook live chat. One question we have from a viewer, and this is open for the entire panel that we have here tonight. How do you know if your child is using? What do you look for?
I'm happy to talk a little bit about some of the signs and symptoms of opioid use. Mm-hmm. In general, opioids tend to have the toxidrome, which is the constellation of effects that it can cause. That's kind of how we refer to it. You can tell a patient might be on opioids because they're acting more sleepy than normal. Sometimes there's itchiness associated with it. A pretty hallmark sign of active opioid intoxication are small pupils or pinpoint pupils. So those are kind of signs of active intoxication, but other signs of chronic opioid use could be more subtle, like withdrawing from you, being more socially isolated, or finding obviously paraphernalia related to opioid use in the home. So there can be behavioral changes, but trying to detect if someone is actively on opioids, which we can do sometimes in the healthcare setting, small pupils, sleepiness, decreased responsiveness are all pretty consistent with opioid intoxication.
All right, another viewer question we have here. The person states, I'm working on a state OUD grant and have found most pharmacies are unaware of the state's standing order for naloxone. Is this something pharmacies have to apply for and accept?
I can also just comment on that. Pharmacies do have to undergo approximately 1 hour of training in order to be able to dispense naloxone under the standing order from, I believe it's currently under Dr. John Lyman. So not all pharmacies, most pharmacies are likely aware, but they don't, they do have to go through a training program, and then they have to log their dispenses of naloxone. All that information is available at the Wisconsin DHS website. Exactly how to enroll your pharmacy. It's a very simple process, and get active in dispensing naloxone, an amazing tool in preventing opioid overdose death in our community.
What advice would you have for people who are struggling with relapses? How can families and their friends, their loved ones, support them?
Well, if this was directed at me.
I'm sorry. Yes, Dr. Feldman, that was for you. I'm sorry.
All right. Well, I just want to say, relapse is really par for the course with opioid use disorder, and it's not a failure. It's depending on what statistics you look at, something like 91% of people in opioid recovery had a relapse at any given point. So a relapse is not failing recovery. Oftentimes, it's a good time to reassess and use it as an opportunity to identify what triggers may have led to the relapse, or if the treatment program that you're in is working for you. Maybe it's time to reassess and you're using an abstinence-only treatment program, and perhaps you need to transition to a medication treatment program or a medication-assisted treatment program. But relapse is part of all chronic diseases, truly. Sometimes they'll be better, sometimes they'll be worse. So just not beating yourself up too much and keeping a positive attitude and doing the work of recovery is what I'd recommend.
All right, let's bring in John McGarry with the DEA, as well as Danielle Long with the Wisconsin Department of Justice. Mr. McGarry, to you, why is the DEA involved in prevention and education? And tell us about some of the educational initiatives the agency has.
Well, we have DEA 360, which we're working with here to bring this production and these engagement programs to educate people and bring in our partners from the health and social service side and other law enforcement agencies to broadcast a message about the risks that are coming into the drug supply that are causing majority of these overdoses. And DEA wants to be involved because these are our communities too. These are our citizens, our neighbors. We believe in engaging the full spectrum, right? From folks who are entering addiction or who are encountering that are involved in addiction as a byproduct of our work, all the way to identifying the organizations that are responsible for smuggling and illegally importing it into the U.S.
And what is law enforcement finding in terms of criminal activity about peddling of opioids, artificial and otherwise?
Yeah, this is a really rapidly shifting dynamic here. I'd say the two biggest things are, which you talked about in your earlier segment. The first is the introduction of fentanyl to the heroin supply, which has long-term, it often fatal and immediate impacts on folks that are expecting to use heroin and instead encounter fentanyl. And it's not just fentanyl. Oftentimes it's analogs or lethal analogs of fentanyl with much higher toxicity or lethal dose percentages that people receive unexpectedly, and then they end up in a fatal overdose situation. And then the other thing is the corrupting of what appear to be legitimate pharmaceuticals, most typically like your oxycodone, the Mbox 30s, being manufactured illegally, typically in Mexico, being made of fentanyl and not having any legitimate production or pharmaceutical production origin, and being sold as an oxycodone. And instead it contains fentanyl, sometimes methamphetamine, sometimes a mix, sometimes cocaine, sometimes a mix of all of the above. And people are receiving these thinking it's one thing, and they end up receiving something that it oftentimes is fatal or kills them. And I don't know if Danielle might have some more to add to that.
Yeah, I think even just in Milwaukee County alone, we've seen the fentanyl overdose related deaths skyrocket. In 2020, we had 408 fentanyl related deaths, and that quadrupled since 2016. So we're really seeing this continue to increase. People don't know that they are taking something with fentanyl typically. And so we have to continue to watch this. Obviously, the DEA and other law enforcement agencies are really watching this very carefully, because sometimes even drug dealers don't know that there's fentanyl in the drugs that they're selling.
And for you, Danielle, as well as John, one question we got from a viewer is, what is done as far as investigating an overdose? How extensive is that when you have a person who you find on any city street who may have, or in a home who has overdosed? How long, how far does an investigation span? How do you tap all of those resources to get to the source, if you will?
I can speak to this, Derek. So without giving up too much of the investigative techniques or the ways at which we and our partners, follow up these things, I'm impressed with the level of exhaustive follow-up that many of these overdose events get. And there is a lot of discussion about bringing in more resources here locally or across the state to address them very comprehensively. But obviously some, because of how the currency or how recent they occur, and the availability of folks that are good and sound witnesses, and our ability to act on those things rapidly so we can follow what I would call an evaporating trail as quickly as we can to exploit it all the way to the source and stop that from continuing to flood the community. Those are really challenging things. And, I would flip this and say to folks, if you are around people, or you are, you see one of these events, or you know somebody, or you're witness to this, the best thing for us and for the folks that are at risk is to be a good witness and assist us in whatever way you can. Because from the moment that somebody is in a fatal overdose situation, we're on a very rapid clock to bring in the resources and exploit this in a way that is beneficial.
All right, thank you. Just looking at a couple of more viewer questions, I wanted to go back to Dr. Feldman for a moment. Someone is asking, if a person is using Suboxone long-term for several years, can they still get high using heroin? Also, can heroin be taken without a needle?
Well, those are a lot of questions. At the end of the day, what stimulates an opioid receptor is whatever's there in the highest concentration. So we actually worry about people who come in actively intoxicated on heroin and get started on Suboxone, which is a drug that only partially turns on the opioid receptor. It's very potent, but because it only partially turns it on and not all the way on, it can actually precipitate withdrawal because you're blocking the opioid that turns it all the way on. I would say if you're considering trying to use an opioid on top of your opioid replacement therapy to experience euphoria, it's time to have another talk with whoever's maintaining or whoever's prescribing your opioid replacement therapy. Yes, heroin can be consumed by drugs. All drugs can go through a lot of different routes and get into a synapse. But at the end of the day, I think this is actually a really good thing to talk about. A lot of the harm that comes from opioid use, I mean, if you look at the CDC, 130 deaths a day, that's about one death every 11 minutes. So during the course of this program, the 90-minute program, we have almost 9 opioid overdose deaths. A lot of those deaths come from medically unsupervised use of adulterated products, as our colleague from the DEA mentioned, with wildly potent opioid analogs like fentanyl at unregulated dosing. Now, medically supervised opioids, like, say, buprenorphine, can help prevent withdrawal and allow someone to get into the right social and environmental situation to get themselves off opioids. So if you're considering, it sounds like, trying to use drugs on top of it, it's probably a good time to reassess what you're going to get out of that and whether or not you should be reevaluating your treatment program.
All right. And John, I'll go back to you here. I know we have likely a lot of caregivers rather, and patients, parents who are watching, and I'm sure they have a lot of questions as to how easy it is for kids to get drugs. And I asked that question going into the event the DEA has coming up this weekend.
Yeah, so this weekend is the National Drug Take Back Initiative, which we have twice a year, where we can receive any drugs, no questions asked. Primarily pharmaceutical drugs are dropped off at various locations throughout the state of Wisconsin and across the country, and then they are incinerated by DEA and our state and local counterparts. The question of access is a really critical part of this discussion, because as users or consumers of pharmaceutical items, we are also responsible for the safeguarding and the securing of those things. And that's where we see many of these narratives begin, is with that ability to access things. And that access is typically initiated through a parent, a grandparent, an aunt, some associated family member or friend of the family who failed to secure things in medicine cabinet, and people who are curious or experimental seek those things out, and then they move down the road of opioid addiction. And I think another part of this is, and Dr. Feldman would probably concur, that it doesn't take much to make that first step, and that first step is often hard to walk back from. So I would say they are out there, and access is widely proliferated throughout our community, but the best and first step is for parents to lock stuff up in a box or throw it away. Bring it to us, bring it to a local police station, drop it in a drop box, no questions asked, and just get rid of it. If you're not using it, you don't need any more, dispose of it.
And Dr. Feldman, John mentioned that first step. A question we have from a viewer here is, what is the difference between experimentation and addiction?
Well, the definition of addiction, honestly, has evolved over time. But truthfully, and it's still kind of a fluid thing, a lot of people would consider addiction when you're having social consequences from use, loss over ability to control your use, sacrificing jobs, friends, family, but it's a spectrum. Either way, I've heard some people say if you're questioning whether or not you have a healthy relationship with a substance, it's probably most people who do have a healthy relationship with a substance don't question that. So it's probably a good time to at least have a discussion with a healthcare provider about those things. And it is a little bit of a blurred line, but yeah, more of the significant health consequences without stopping use and loss of control over use can really help define when we have an unhealthy relationship with that substance.
Can I interject for a moment here?
Absolutely.
I feel like it's important also to note that there are resources to help parents have conversations with your children at early ages. I think some parents can maybe find information in their child's school from their adjustment counselors, health teachers. I think the DEA has some great resources as well. I personally am a parent of an 8-year-old and a 5-year-old, and we talk a lot at home about medicine and about why it's important for them to only take medicine when I give it to them, and how the orange bottles are different than the ones that you buy on the shelf at the pharmacy. And the orange bottles have to have the right person's name on it, and you have to read the directions really carefully. I think there's no such thing as a foolproof way to arm your children with the information that will prevent them from becoming addicted to a substance. But I think creating informative years and understanding of sort of the importance of monitoring that relationship with pharmaceuticals is never a bad thing.
And a very frank question we have here is, what should I do if I suspect my child is taking drugs?
You can find resources for drug testing. You can bring your child to the pediatrician, I think, probably. There are quick cups. I mean, I would also ask the doctor's perspective on this, but I know Jim, my boss, talks a lot about how it's important to be our children's parents and not their friends, and to make sure that there are, if you suspect that something is wrong, it's better to really investigate that than to not.
Dr. Feldman, I saw you were going to say something.
I just wanted to concur with Ashley. It's a great time to bring that up with a healthcare professional that can assess that at their, it depends on the age of the child, but, with their primary care provider. Because we want to get, earlier use of substances is also a predisposer to developing substance use disorder while the brain's still developing. So get help, get other people, other healthcare providers involved in assessing this with you. Absolutely.
And Dr. Feldman and Ashley, I guess I can pose this question from our viewer to both of you. They say simply, how can you make someone get help if they don't want it? This person says they already lost their grandson's mother and their son to suicide. Where can they go?
I'll leave that to Dr. Feldman, because I think different states have different approaches in how they deal with things. I'm a Massachusetts resident, and there are ways that you can make someone get help, but you can only lead them so far. There are ways to sort of separate them from their environment for a certain amount of time, but they really, I think, have to be willing to put the work in to sort of maintain that abstinence or a different relationship with substances.
And I would say, I guess I have a few comments on this. If someone's expressing self-harm, suicidal ideation, it's a great time to get law enforcement involved if they're not able. That's at a point where someone's not able to make decisions for themselves, at which point, and they absolutely need to get in contact with healthcare, where they can get a full assessment, get in contact with other healthcare providers that can actually initiate treatment for underlying mental health conditions. And if you suspect, at any point that somebody is trying to overdose on a medication, you can call 911. You can also and have someone come assess the situation. And if you are worried about the toxic effects of a drug overdose, I call 1-800-222-1222. The Poison Center is there to help assess these situations and get the medical help someone would also need if there was a potential ingestion. And these people need to get to a healthcare facility, get to an emergency department if there's serious harm going to happen.
And I wanted to bring Danielle Long back into the discussion as well in terms of what we saw in 2020 dealing with the pandemic. We are still, dealing with the pandemic, and it clearly impacted folks who are in recovery. Can you identify some of the biggest challenges with substance use disorder, with the challenges those people are experiencing, and tell us how the AG's office has tried to deal with those challenges?
Well, there's no doubt that 2020 was quite the year. I won't use any vacation words because this is TV, but a lot of challenges, and especially as we've seen those who are struggling with substance use disorder, relapses, and those who probably tried medications or tried drugs for the first time, the isolation, loneliness, depression. And I think we're going to see the ripple effect for that years to come. And I think, one of the things that we've seen, I coordinate the drug take back program for the Department of Justice along with John's office, the DEA. And we work so hard to make sure that people dispose of medications, and especially now when people were home, right? You had adult children who were coming home from college. You had people who were multi-generations living in the same house together for a period of time. Probably wasn't easy for a lot of different reasons. And those unsecured medications were people had access to those. So, as John was saying, the importance of disposal. We've got Drug Take Back Day coming this Saturday, April 24th. We have over 485 drug disposal boxes around the state of Wisconsin. And I really want to urge people to go to our website, which is doseofrealitywi.gov. You can put in your zip code and you can find the closest drug drop box to you, whether that's at law enforcement, hospitals, clinics, pharmacies. You'll find the events that are taking place. But we really want to get the point across that you don't have to wait until one of those two events per year. That 24 hours a day, you can drop off your drugs, get them out of your house, especially, like I said, during this pandemic when people were all coming home and living together. When you have people in the house that are struggling with substance use disorder, you've got to make sure that those medications are stored safely. I think the other thing, and Dr. Feldman had talked about this, I've got my prop, but the importance of naloxone. This is Narcan, a brand name. I can't stress enough that all people should have this. This is for people who are prescribed prescriptions. We see elderly individuals who are overdosing. We see people who are using recreationally, but it should be, it's almost the equivalent of an EpiPen. People should have it on hand. It's easy to get, thank goodness, because of the standing order. And that's a great way to prevent overdose.
All right. Thank you. Thank you, Danielle. We're coming close to the end of our 30 minutes here. I wanted to give every one of our guests just a chance to give our viewers just some final words on this topic. I'll start with you, Dr. Feldman.
Thank you. I just wanted to touch back for a moment on the person who mentioned not being able to help their loved one with substance use disorder. Don't do this alone. There are support groups out there. Al-Anon is one group for family members of people with substance use disorder, and you could go there for other support and resources and how to engage with your loved one on getting into recovery. The second part to that is be prepared to deal with the side effects of opioid use disorder, which would be things like overdose, and to keep them alive through that. Exactly as Danielle Long said, this is a public health crisis. And when we have public health crisis, we need to engage the public in helping change it. Naloxone is a 100% effective antidote when given at an appropriate time. It's almost harmless to give it. There's no opioid overdose going on. Everyone should be trained to use naloxone. If you can use a nasal spray, you can save a life. And that is something that's amazing. And finally, with something like 80% of people entering heroin treatment programs reporting that prescription opioids were their first opioid they used, it's incredibly important that we get excess opioid supply off the street and out of the families or out of the community. I think over 50% of youths using prescription opioids report getting it from a family member or friend, as John mentioned. So it's very important to get those drugs out of your cabinets and into the drug take-backs. Thank you.
John McGarry, final thoughts?
Thanks, Derek. I think for me, the biggest takeaway in seeing this problem evolve is that the entire community needs to be involved and engaged in the solution for this. You can see assembled here tonight is a really broad coalition of folks from all sorts of backgrounds. And that law enforcement alone isn't the only solution to this problem. And I think everybody in the community, every citizen, everybody that lives out there in Milwaukee and in every other city that's enduring this crisis needs to be an active participant in working on a solution, wherever that is, at schools, at churches, at community centers, on playgrounds, on youth sports. Everybody needs to understand and take an opportunity to broadcast this message and talk to young people.
And Danielle Long with the Wisconsin Department of Justice.
Well, I think like Ashley Nowakowski from Your Choice said earlier in the program, it's the importance of having these conversations and preventing that first-time drug use. One of the questions that was asked earlier, and as Ashley said about being your child's parent and not friend, one of the things that Ashley from Your Choice talks about all the time is that people say they continue to use because no one ever asked, no one ever stopped them, no one ever had the conversations with them. The parents didn't talk to their children. You can't stress enough how important that is because, one thing leads to another. And as Dr. Feldman said, the addiction starts by using someone else's prescriptions. So we've got to store them. We've got to make sure people are using them responsibly. And we also know that people ages 12 to 25 are at a higher risk of addiction based on the development of their brain. And so that's really big. When I talk to parents, I say, your son is injured in a soccer game and goes to the emergency room, really think twice before allowing a doctor to prescribe an opioid. I personally would not let my teenager take an opioid because I know just how easily they could become addicted. And once that starts, it is a long, hard road. So parents just, need to be aware and need to understand these things as the parent of their children. Thank you.
And Ashley Webb-Caleri will give you the final word from the Mark Wahlberg Youth Foundation.
Thank you. I think it's important, as was, I think, raised earlier here, addiction really flourishes in isolation, and it's been a tough year. So check in with your people, check in with the people that are having a hard time. Nobody sets out to be addicted. And I think it's important for people to know that other people care about them. So I think as a community, just care for one another. Thank you.
All right. Thank you very much, Ashley Webb-Caleri, Dr. Ryan Feldman, John McGarry, and Danielle Long. Thank you all so much for your time, primarily, as well as your expertise on this topic. And we want our viewers to know that they can watch our special. If they missed it tonight at 7, you can watch it again. It is State of Addiction, What Every Family Needs to Know About Opioids. We will be re-airing that broadcast this Saturday at 4 o'clock, the same day as the Drug Take Back Day. We have all of this information on our website. And if you or someone you know needs help, you can go to wisn.com/opioids for a list of resources. Thank you all for joining us tonight. Have a great evening.